All right, and maybe just in the trying to be cognizant of time, we'll just dive right in. So welcome. This morning, I'm joined by Kim Masterson. If she wants to put her video on, I will put on mine for a second. Hi, I'm Leanna Tempany, Therapy Team Lead and SLP, and I'm joined by Kim, who's one of our lovely psychologists here at the district.
I've noticed, Nancy, is it maybe your volume on your end that it's quiet? Because we're turned up as loud as we can be.
Yeah. There's Kim. Okay. And I will jump right into the presentation. So if we can just center ourselves and start with a prayer for confronting fear. Heavenly Father, when I feel crushed by my own worries, lift my mind and help me to see the truth. When fear grips me tight and I feel I cannot move, free my heart and help me to take things one step at a time. When I can't express the turmoil inside, calm me with your quiet words of love. I choose to trust in you each day, each hour, each moment of my life. I know deep down that I, in your grace, forgiven, restored by your sacrifice, you have set me free. Amen. And the land acknowledgement, the Creator gifted us with this land that we are blessed to share and care for together. The Calgary Catholic School District acknowledges that the land we gather on, Mohkinstsis, is the ancestral territory of the Siksika Sitapi, the Siksika, Kainai, Piikani, and Amska Piikani. We acknowledge all the Treaty 7 signatories, including the Tsuut'ina people, as well as the Ayarhe, Nakota Nations, Bearspaw, Chiniki, and Wesley. This land is also the home of Métis Nation Region 3 and all others who call this place home. So really quickly, we just wanted to note the Board of Trustee priorities, that this presentation on selective mutism and reluctant speakers would fall into both student success as well as wellness. And what is selective mutism? It's an anxiety-based disorder where an individual has the ability to talk in some situations, but not in others. And they would be experiencing potentially intense fear of being seen or heard speaking in certain environments. Most typically, the student is comfortable speaking at home, whereas at school, they're uncomfortable speaking and it might look like whispering or not speaking at all. Selective mutism is a medical diagnosis made by a mental health professional. So, and we really want to stress that unless the diagnosis has been received, we're going to refer to children presenting this way as reluctant speakers. So selective mutism is not about oppositional behavior. So while it might seem like the student is refusing to speak, actually they're extremely anxious and they're experiencing an inability to speak, even if they want to. So this is not a choice. It's also not autism. So we really want to do that differential diagnosis and be looking at all the factors here to determine what's going on. So absolutely both groups of students may present with communication and social skill challenges, but the difference is a student with selective mutism can still pick up on nonverbal cues and emotional subtleties in a way that a student with ASD might not be able to. And there's that difference in environment. So a student with selective mutism might show very typical social skills with their family, whereas a student with autism is going to show those same challenges across all environments. Selective mutism is also not about a trauma basis. So it's a misconception that selective mutism is rooted in trauma. And selective mutism is not caused by poor parenting or family dysfunction. We've also, there's a additional slide on this as well, but we want to note that we want to rule out whether this is about second language learning. So when a student speaks a different language at home, we want to make sure that we are ruling that out, figuring out whether this is about a silent period or this is actually about reluctant speaking or selective mutism. So selective mutism is also not about social phobia. So selective mutism, we usually see it appearing around ages 3 to 5 as we enter the school system, maybe starting a preschool program, that type of thing, or first experience might be kindergarten. Whereas with social phobia, we're going to see it emerging later, usually around 10 or 11 years of age. A student with selective mutism may interact comfortably with others through nonverbal means, whereas we are not going to see that in an individual with social phobia. Selective mutism is also not separation anxiety, and it is not shyness. So we might see that as something we need to rule out as well when we're looking at their behavior across all environments. So looking again at this comparison, a child with selective mutism might look quite talkative at home, restrained at school, whereas a shy, quiet child would look fairly typical across environments. A shy child would eventually warm up and be able to speak in a social situation. A student with selective mutism does not start to speak in an anxiety-provoking situation just because a little bit of time has passed. Shyness is a personality or temperamental trait, whereas selective mutism, as we mentioned earlier, is a diagnosable mental health condition. And second language acquisition silent period versus selective mutism. So as I noted just now, we might see when a student is exposed to a new language that they're really focusing on that silent period, meaning they're listening, comprehending, trying to figure out the language. These students can also look very quiet and they might be speaking very little, just as we would in a foreign country. But the thing is that period is going to look different. And so we want to rule that out and work and see between our ELL team, our speech language pathologists, other professionals involved, what is going on here? Is that a factor or is this a reluctant speaker? So again, the younger the child, that silent period in a true second language acquisition silent period might look longer. With older kiddos, it would likely be a shorter period of a few weeks.
Okay, some features of selective mutism. So it's important to know that children are often not just fearful of being heard speaking, but they're often also fearful of being seen speaking. They tend to be chronologically over-aroused physiologically compared to their peers. They tend to be more anxiety prone. They may have more somatic complaints such as stomach aches, headaches. They often do have weaker skills socially, even in nonverbal social interactions. Many children with selective mutism often have fears being seen eating or using the bathroom at school. There's a frequently a family history of social anxiety or a shy temperament. 50 to 90% of individuals with selective mutism end up being diagnosed with social anxiety. So that's important for us to note. So even when the child starts speaking at school, we want to monitor to see whether they're experiencing social anxiety. And children with varying intellectual disabilities intellectual abilities can be affected. So not just a certain level of intellectual functioning. 1 to 2% of children have selective mutism, which would translate into probably about 1 child with selective mutism in every 5 classes. It is more common among girls. Many children with selective mutism also have a social anxiety disorder. And most children develop selective mutism between the ages of 3 and 5. Despite this, it's often not identified until school entry. That's because most individuals with selective mutisms are comfortable speaking at the home, so it's not until they join another environment such as preschool or kindergarten that we notice their difficulty with speaking. How long does selective mutism last? It varies. So it's up to 89% typically recover with behavioral models of treatment. Without treatment, it can persist into middle school, high school, and even into adulthood. So that's just want to emphasize the importance of the treatment. If you can imagine the impact that not being able to speak in public would have on an adult, even just with their ability to find employment. How do children with selective mutism do academically? It doesn't necessarily interfere with academic development, particularly in the early grades. Children with selective mutism typically acquire reading, math, and written language skills at a rate that would be expected given their level of intellectual functioning. There is less research, less known about the impact of persistent selective mutism, so of that on the academic development of older children. What the child might feel at school, they will certainly be experiencing a level of fear from the expectation to speak. It's been described as feeling of their throat being paralyzed or having glass chips in their throat. And they, of course, will try to protect themselves, which is what they're doing by not engaging in speaking, is to help reduce that anxiety. What the adult might feel, they might feel that the child is oppositional, defiant, or trying to manipulate you. This is definitely not the case. The child is unable to speak despite potentially wanting to. Children with selective mutism are not more oppositional than their peers. The adult might feel that it's personal against them, which it's not. They may find it difficult to connect with the student, and then of course a desire to fix the situation. What you might see at school is that the child is whispering or doesn't speak at all. They may seem sullen or anxious. They may appear frozen when spoken to. That's speaking. They might, the expectation to speak if you ask them a question will cause that anxiety to go up. They may or not respond non-verbally. Some individuals interact very well non-verbally, whereas others may not. They may interact well with their peers in a non-verbal way, and they often won't communicate with the teacher. The teacher is often the last person that the child starts to speak to at school. What parents will see at home, I encourage you to look up some videos. We've shared videos in previous presentations, but they're often very talkative, playful, expressive, outgoing at home. This is often why we have difficulty getting parents to understand our concerns at school, because they're saying, well, he speaks at home, what's the problem? At home, they may see their child playing with neighborhood friends, but it is possible they might not talk to certain family members, particularly family members that are not as familiar, like say as an aunt and uncle that they maybe only see once or twice a year. They may not feel comfortable speaking in front of them. What causes selective mutism? There actually has been no formal cause established. However, there are possible primary contributors. So genetics, research has shown that there is the possibility of a genetic influence. There's typically a family history of shyness or social anxiety. Temperament, they often have a shy, slow to warm up kind of personality. There are speech and language difficulties in approximately 1/3 of cases. And then lastly, adjustment to a new culture. Selective mutism is 3 times more likely in immigrant groups. So once we rule out that it's not a silent period, but we do know that it is more common in immigrant groups. Factors that cause selective mutism to persist. Obviously, the misdiagnosis or failure to identify selective mutism is a problem, because then we aren't, educating ourselves in the ways to interact with these students. Lack of effective early intervention is paramount. We want to intervene as early as possible and use the effective interventions, which we're going to run through later on in the presentation. A lack of understanding by family, school personnel, if we're applying excessive pressure to speak on the student, that's going to increase their anxiety and cause selective mutism to persist. Even other professionals can have a lack of understanding, such as a family physician. There's the applying excessive pressure to speak. That's the example that I use is, I personally have a fear of snakes. If you threw me in a room full of snakes, that would probably cause me a lot of trauma and increase my fear of snakes. So if we apply excessive pressure to speak, they're going to experience increased anxiety, and it's going to cause selective mutism to persist. And then negative reinforcement from others for not speaking. So I just want to clarify that term because it's often misunderstood. So negative reinforcement is the removal of something negative which serves to strengthen the behavior. So when the child doesn't speak, it reduces their anxiety. So the removal of something negative, which increases them not wanting to speak in the future. This next slide is some examples that cause selective mutism persist. So inadvertently, adults who are answering or speaking for the child are causing it to persist. Rescuing the child from speaking demands by just explaining that, oh, they're just shy. And accommodating the child's non-speaking by mind reading for them or accepting nonverbal responses. Of course, it's a balance. Initially, we are going to accept nonverbal responses, but we're going to work towards encouraging them to speak. So the cycle of non-speaking. Most treatment programs at school use a behavioral approach or conceptualization. The expectation of speaking in a certain situation is a trigger for an increase in anxiety. The response to increased anxiety is the avoidance of speech and serves to reduce that anxiety. Avoidance is negatively reinforced over time when it is successful in reducing the child's anxiety that was triggered by the expectation of speech. So for example, a child may become anxious when the teacher asks a question. The child's anxiety increases as the teacher and the class wait for a response. The anxiety will likely cause the child with selective mutism to avoid answering the question, and this avoidance may successfully result in a decrease in their anxiety. The reduction of anxiety then reinforces the avoidance, thus strengthening the avoidance or non-speaking behavior. And I'm seeing some people are having difficulty with their sound. We are turned up, and there's other people who are hearing fine. So I apologize. This session will be recorded and uploaded to EPD. So if you're not able to hear, you can access it there. Quickly going through truth or myth. The first one, selective mutism comes from a place of defiance. That is a myth. The child is unable to speak. It is not a choice. Children with varying intellectual abilities can be affected. Yes, that is true. Selective mutism is rooted in trauma. That's a common misconception. Selective mutism is not rooted in trauma. Selective mutism negatively impacts academic development. We know that that is a myth, particularly in the younger grades. Individuals with selective mutism rarely speak in any environment. That is a myth. They can be quite boisterous and outgoing in an environment where they feel comfortable, like at home. Selective mutism typically resolves in 3 to 6 months with intervention, and that is false. That time frame is way too short. The treatment of selective mutism tends to take several years, and can take longer. So 3 to 6 months is much too short of a time frame to expect the child to be speaking comfortably. There is frequently a family history of social anxiety or shy temperament, and yes, that is true.
Okay, so we're going to jump into this in a little more detail as we move forward. And if I could just ask everyone to please mute your mics, that might help with some of the feedback. So research shows that effective interventions happen at school, and we know that we need everyone on board. That's going to promote the best possible outcome for intervention and support, meaning parents are on board, our school team is on board, and we'll talk about a management team in a minute. So what should we do if we have one of these students that's a reluctant speaker or has the diagnosis of selective mutism? Calgary Catholic has a 3-stage process, and I want to highlight that we have the manual uploaded. I put a link at the beginning of the chat. So an EPD on the CCSD therapy team site on the SLP page, I'm sorry for all of the steps there. In the left column, you're going to see a number of resources that have been uploaded, including the whole manual, as well as a bunch of handouts and resources that we're going to give you a little bit of a snapshot into today. And also this information is included in 2 longer sessions that Kim and I recently recorded again last fall, and you're going to find recordings for those as well as the PowerPoints, and then a number of resources that we're going to talk about here today about making this plan. So as you see, just like in our request for support, you're going to start with school-based action, you're going to involve DLCT supports when needed, and then the learning services team as well. And you're going to find a link online to people recognized in the district as resources when we need to reach out for more support. I also want to note that if a student was deemed to be a reluctant speaker and during this process you receive that letter of diagnosis, we can submit a request for support and a code can be applied as we move through the other stages. So as I noted, the manual is online, and we want to stress that we would not hand out or share that manual with families, but there are some parent handouts selected on there that you can share. And then jumping into suggestions that would be helpful at school, the do's. So again, remembering that selective mutism is about anxiety. This is not defiant behavior. We want to work towards increasing a student's confidence and self-esteem while reducing anxiety. We want to let the student know that that we accept that they find speaking difficult. So we have empathy for their situation. We're going to help decrease their sense of loneliness and isolation when possible. We want to maintain quiet confidence that the student is going to speak when they're ready. And we use social rewards, including smiles, nods, and well done, that we would use to make that experience similar to the way we're treating all other students in their environment. If the student is comfortable interacting with adults, we want to provide opportunities for them to continue to do this. We want to work collaboratively with that management team, so those key adults, to decide what interventions we're going to put into place. We want to make sure the student has opportunities to participate in all activities in their own ways. So again, we want to be creative about how they can participate. We want to invest time in building up rapport through nonverbal activities. We want to remember to include that student in jokes and humor. We may decide that using additional symbols like augmentative and alternative communication, different visual supports, or other devices might help them to communicate. We might want to offer them a prompt or help structure a situation if this student looks lost or unsure, such as, hey, can we help Adam build a tower? And remember that we are, or rather to be reminded of all forms of nonverbal communication we could also respond to, including eye contact, smiling, nodding, and shaking our head or shaking their head. Things that are perhaps less helpful, so the don'ts. So again, we really want to avoid pressuring that student to speak in any way, and we would not be rewarding, or rather withholding rewards for not speaking. We want to remember that the student wishes to speak, but they cannot. Drawing too much attention to the student for not speaking or for speaking. So again, we want to treat them in a way that we're treating other students. We want to remember that they're self-conscious. They might feel uncomfortable if we're drawing a lot of attention to them until their confidence improves. And we want to be really conscious of the language we're using around them. So we would not be using labels like telling other students or adults that, oh, that she's the quiet one. And we want to be cognizant of not pressuring students to mix with other kids as much as peers, because we might really need to facilitate that interaction and offer more support to allow them to be comfortable. My apologies that this kind of got blown up on the slide. So this handout can be found in the resources I noted on that SLP page so that you can read the whole thing. And I would encourage people to refer to it because it's got some good ideas about specific situations and what we can do in a strategy we can employ in that situation to help the student. Other considerations, so classroom seating can be really important, just like it is for students that present with other needs. So thinking about location might really improve that student's comfort level. So we want to be aware of, you know, who they're sitting around, what their location in the room is, how comfortable they are being close to a teacher. So, you know, we might want to think about things like the back of the class would offer more privacy typically, and there might be fewer students that are behind them that might make them feel anxious. Staying away from doors where there are fewer distractions and fewer people that would look from outside the classroom might increase comfort. And again, like I said, depending on their comfort with the teacher, being further from the teacher might decrease anxiety. It just really depends if that teacher is a preferred person. Being conscious of keeping them near the front could be a factor if there are learning issues or the student is inattentive. And again, being aware of high traffic areas, which could really increase anxiety. And we want to note that we really want to remind any guest or unfamiliar teachers, unfamiliar staff that might pop into the room. We want to make sure that they're aware of the student's needs so that we don't inadvertently increase anxiety for them or really put them into a situation that might interfere with their progress they're making. And staff education. So again, we just want to make sure that everyone in the building and everyone interacting with that student is aware of the do's and the don'ts. So we're really promoting that comfort. And over to Kim.
All right, so some strategies and tips for working with selectively mute students in the classroom. Remembering that it's often not just the fear of being heard, but also seen speaking. So you may want to minimize your eye contact when working with a child, perhaps by placing your focus on something else other than the child, such as toys, books, or the materials you're working with. Have no expectations for whether or not they speak. Beneficially interact with the child without asking open-ended questions that would remove their ability to nod or shake their head in response. Respond to the child's gestures as if he or she is speaking, so wanting to treat them like you would treat other students. The use of nonverbal tasks, so for example, to test a child's phonological awareness, you may have them sort plastic letters in alphabetical order to test their alphabet ability. You might have them sort pictures into rhyming groups or use checkboxes to indicate whether two words sound the same, match pictures with the same initial or final consonant sound. Untimed tasks is beneficial for any individual who experiences anxiety, whether it's selective mutism or another form of anxiety. Allowing frequent breaks would be beneficial. And of course, allowing nonverbal forms of communication such as gestures, nodding, pointing, etc. Some more tips would be allow the child to respond using pictures, or perhaps with writing if they're able to write. You may want to utilize video or audio recordings, but just ensure that the child has given you permission to do this. If the child is able to and comfortable with being recorded reading at home, and then having you view that video or audio recording afterwards, just make sure that you get the child's permission. And you may allow the child to show responses using math manipulatives. Academic assessment tips would be having a familiar person administer the assessment, and then again, evaluating the child's skills at home with a video or audio recording, just ensuring that that has been okayed by the student. You want to promote active non-verbal participation. So for example, during attendance call, you could allow for hands up or a head nod versus having to use a full voice. And I would suggest you allow all students that, so we don't single out the child who has selective mutism or is a reluctant speaker. Accept gestures in place of verbal communication, such as head nods, shakes, thumbs up, thumbs down. You may want to have the whole class respond loud in unison. That can encourage a child who's a reluctant speaker or with selective mutism to speak up if they're not the only person speaking. So that way the focus isn't always on them. And when children have completed a project, ask the entire class who would like to present their work. There may be several students who don't feel comfortable speaking in front of the class. For example, a child with a specific learning disorder in reading may feel very uncomfortable if asked to read in front of the class. So if you identify other children who are reluctant to speak, this helps to make the child with selective mutism or the reluctant speaker feel like they fit in. We can assign the child tasks that don't require speaking. So we do want them to feel like a contributing member of our community in the classroom. So things like handing out papers, tidying book areas, running errands to the office. You want to speak with the child without expecting an answer. So for example, you may say, "Hi Tess, sounds like you had a fun weekend. I love skiing too. Hoping to go next week. All right, let's get our agendas out, okay?" So reducing that pause, that expectation for speech, will likely help to decrease that child's anxiety. And let the entire class know that you will only call on students who raise their hands. So this takes the pressure off of the child, since they never have to be worried about being put on the spot. And again, like I mentioned, for example, with a child with a specific learning disorder and reading, it can help decrease anxiety for other students as well.
Awesome, thank you, Kim. And so I just want to stress more of this intervention piece. It will be explored in greater detail because of our time constraints today. If anyone wants to refer to those PowerPoints and recordings already uploaded on EPD, so this would be further explored in session 2. And so you're welcome to look at all of that for greater information as well as the manual. So this is just a quick visual showing you exposure training. So when we talk about conversational visits, it's a behavioral program. We're looking at gradual exposure or desensitization over time. The goal is to increase the number of people the child speaks to in the situations they speak in, and that it's step by step. So like Kim had mentioned about fear of snakes, if we look at a plan like that, desensitization would not go from, okay, I'm terrified of snakes, to I'm going to be thrown into a room with a ton of live snakes. So we're just really working over time to improve that student, or to give that student more comfort, reduce anxiety, where it's going to be gradual, and we're really just trying to put a plan into place to build success. So one of the critical steps is developing a management team. You're going to find all those resources, like I said, on EPD to figure out how to set this up in a meaningful way. And just to stress here, we really want to share this today with teachers and EAs because we know you will be critical pieces in this management plan when you have students that are reluctant speakers or have selective mutism. And we want to make sure that we have a lot of patience. And like Kim said, this process takes time. And so this is not going to change overnight or in a few weeks. We want to make sure that we involve parents because they are really a critical piece of this factor. And we need to make sure that they're aware of what's going on. So again, things might look very different at home. So whenever possible, we want to share what we're seeing at school and get them on board. And that second session goes into great detail about all the roles that a parent might play in this management plan to really build these skills across different environments. What are school-based conversational visits? So this is an opportunity to practice comfortable speaking at school. And we're thinking about starting with those people that the student is most comfortable with. So sometimes that's a parent, it might be a sibling, it might be a preferred EA, the teacher, a librarian. It really is case by case. And sorry, initially, we might want to consider this being out of classroom involving only the caregiver. And the purpose is, again, to encourage comfortable speaking. And then you're going to see in our visuals on the subsequent pages how we work on that. So constructing an exposure hierarchy, like we said, we're thinking about this being just really comfortable, gradual. We're transferring from one successful situation to a new successful situation. And the conversational visits and the ladder are what we use to do that. So again, you're going to find more detail online and resources to do so. And you're going to do that by considering the child's comfort with certain people, locations, and activities. So the first visit, again, is going to be that most comfortable situation. So an example might be mom in a private office with the door closed, playing a familiar game. And we know that more progress happens more quickly if the visits occur frequently, they're lengthier, they encourage speaking, and they're comfortable and relaxed. And so we're going to use those tools to figure out what we need to do to move that student up the ladder. The conversational partner, we want to stress, is likely the most important dimension, the one that carries the most weight in moving this student forward. So we want to be really careful in considering who are the conversational partners we want to involve. And so that's another reason, again, that's so critical to try to get the family on board, because parent might be their most comfortable initial partner. We also want to look at locations. So we're thinking about physical spaces and settings at school that are comfortable. For some students, that might be starting in the playground, in the library, somewhere super comfortable. And that most typically that location is going to offer a lot of privacy. It might look different than the classroom when the classroom has maybe been that place associated with anxiety. And it is not held previous relationship with a pressure to speak. So again, it's thinking about the same concepts and principles as the seating arrangement. And then activities. So again, this is going to vary. This is going to depend on the individual interest and familiarity, comfort level of that student. And again, we're thinking about activity around their comfort level, the power to elicit speaking, and their enjoyment level. So we want to think about other things we could use. We can be really creative about bridging tools to build that progress over activities. And so again, this emphasis, the visit is not placed on speaking. It's more building that familiarity and comfort. And so the conversational ladder, again, we're thinking about people, locations, and activities, and we're going to integrate them. So there are worksheets you're going to find in those resources to think about these three factors. And we would work through all of the steps on the ladder with the same person before we introduce another person. So again, we're going to vary the location and the activity and move up the entire ladder before we change the person. So I know this is a little bit tricky to see. These can be downloaded from that EPD site. So as you're going to see in this example, it's mom moving up the ladder from the bottom being very comfortable, somewhat uncomfortable, very uncomfortable. And we're just moving up mom through different locations. And we would be keeping mom and the activity consistent. So again, we're only varying that one factor, and mom is doing 1 to 3 visits per week. So that would be how we move up in that step-to-step gradual process. So tracking, again, we want to make sure that we are utilizing the tools to make sure that gains continue to be made. There's slow but steady progress. And we're going to talk a minute about how we manage things if we are not seeing that progress. So you will find, again, some forms that might be helpful in tracking that in school and at home. This is just an example of one of those, recording the conversational visit, just like we saw on the ladder. This would be the notes from it. And we will turn it over to Kim to talk about what we do with stalled progress and what it is.
Okay, so stalled progress. So it is very important to maintain momentum. It's absolutely critical. It is much more difficult to initiate new gains after a child has coasted or has stalled in their progress. Sometimes stalled progress is evident and easy to recognize. Other times it may not be. So when increased communication takes form that constitutes avoidance, such as whispering or making atypical vocalizations in lieu of speech, relying too heavily on nonverbal or written forms, that might be less easy to recognize. Some problem-solving strategies for addressing stalled progress. And it's helpful to first identify the reason for the stall. For example, is it possible that the intervention planning was short-sighted or halted due to apparent progress? Was there a specific incident that occurred that caused the stalled progress? So for example, a change in teacher, if a close friend moves, was there an incident where there was significant pressure to speak applied? Were non-oral communication methods used, and now the student prefers these? So when we're looking at wanting to revive stalled progress, it's important to carefully identify where progress was last made. So that's where you would want to rely on the progress log form that Leanna showed. So you're going to want to go back to where the child was last successful on the conversational ladder. And once you've reestablished that momentum, then you are safe again to move forward. So some relapse prevention. It is important to maintain momentum during all intervention phases, and frequent planning ahead as a management team is important. So you want to keep an eye out for potential stalls before they become habit forming for the student, and be sure all members of the management team understand the importance of momentum and that there's likely still work to be done. We want to be cautious that we don't end the intervention too early. Sometimes we are tempted to think that when the child's made some progress, that they're just going to naturally continue to progress on their own, but that is not the case. Some more relapse prevention. After a child starts speaking, here's the part I just said. If they start speaking more frequently, it's tempting to assume they will naturally continue to maintain and face new speaking situations, but that is not the case without support. It may be helpful to prepare a list of strategies that were most helpful to increase frequency of comfortable speaking to use when a slip occurs. Monitoring by the management team can allow all team members to be aware of any slips earlier on. And continued practice and monitoring at the end of the intervention is the best way to prevent future issues. So just a note on slips, setback, relapse, and regression. So slips are more minor, and they usually happen after a break from school, such as Christmas or short-term absence due to illness. These can usually be addressed fairly quickly through revisiting the conversational ladder and through practice. It only becomes a real concern if it continues to worsen over time. So the next level of severity would be a relapse. That's a more intense backsliding towards the original problem. So slips can accumulate or can intensify towards a relapse. And then lastly is regression, which is the more of an extreme case. And after a traumatic experience is when that typically occurs. So if there was excessive pressure applied on the child to speak. Just a note that if you are working with a student with selective mutism, there is a working session coming up on February 7th, and there's a link on the EPD site if you would like to sign up. And lastly, just a review of some important points. It's educate all staff who work with a student. We really want to avoid, say, a guest teacher or a parent volunteer applying excessive pressure to speak, because that can really set a children into a relapse. So again, interfere with volunteers in the classroom when needed. When people surrounding a child with selective mutism understands selective mutism, the student is likely to feel more accepted and comfortable. And we want to make sure that we are engaging in safety planning. So again, planning for guest teachers or when we're going on field trips. There was a student who went the entire day with a broken arm because he was unable to express his pain to an adult. So especially for field trips, just because there's obviously a greater degree of risk during that. So lastly, every child will need a patient and persistent approach, but there is a great reward at the end. So we do have a few minutes left before 11:30. I don't know if there's anybody who has any questions. You can either unmute yourself or put it in the chat. Myself and another psychologist will also be holding open office hours with a focus on selective mutism. If you want to join us between 1 and 3, that's more of just a open conversation, come and go kind of thing. So any questions could be address there, or also feel free to email either myself or Leanna with any questions after the presentation. But if anyone has anything that they want to bring up now, feel free to put it in the chat. Safety planning items to get started. Yes, like an example, like bathroom. Always make sure there's a way for the child to communicate if they need to go to the bathroom. You could have a visual that they could produce to you to express that they're in pain or they're hungry. Just sort of have that established with them. Like, you know, if you are ever hurt at school or at any time when you're with your class, bring me this picture and I'll know that you are in pain or that you need help, and we'll try to find a way for us to communicate about that. What would another example be? The eating piece. We don't want children going all day without eating at school. So if they do have a fear of eating in front of others, ensuring there's a place that they can go and eat in a more private situation. Those are just a few examples. There certainly would be more in the manual that's on EPD.
And I think, Kim, we've talked about, you know, with things like bathroom outings, like if young students were together, I mean, rather than drawing someone out individually, maybe offering opportunities for a group, and it's kind of then universal, everyone's doing the same thing. So no one is singled out if perhaps that student has to go and they're not going to advocate for themselves.
Mm-hmm. And that's interesting. Olivia just put in the chat that the session link does not work if you've already completed a review for your earlier session. So does that mean that no one will be able to complete?
Oh, interesting. The feedback.
Yeah.
Okay. That I will share that information with our principal at St. Leo. That was the only link we were given, so our apologies.
Yeah, if a child doesn't have an actual diagnosis of selective mutism, refer to them as reluctant speakers. Would you see selective mutism with echolalia? Typically, echolalia occurs in autism, and so as we kind of mentioned, selective mutism and autism are not the same thing. Both individuals would have difficulties with communication, but for different reasons. So if the individual is engaging in echolalia, without knowing more details, I would be inclined to think that that individual has autism and not selective mutism. What would you agree, Leanna? Oh, I think Leanna got kicked off again. This happened at the end of our last presentation too. Any more questions? Feel free to stay on if you do have questions. I'm available for a while here to talk and answer any questions. Otherwise, all the documentation information from previous sessions is uploaded along with the Selective Mutism manual on the EPD site. This session and PowerPoint will be uploaded. And again, there's a open office hours this afternoon. If you want to join between 1 and 3, it's kind of a come and go thing. Or feel free to email either myself or Leanna with any questions if that's works better for you. What to do if parents do not want to meet and they avoid calls? Oh yes, parent reluctance is a tough one. We speak to that in more detail in one of the presentations that is already uploaded to EPD, but just I think to emphasize, point out to parents, like if we don't address this and your child is unable to talk in high school and even adulthood, just imagine the impact that's going to have on that individual's life. They're not going to be able to find employment. They may struggle with, even activities such as going to the grocery store. So just to really emphasize the significant impact that this can have on their child, take away blame, say this is not your fault. We know this is not your fault. This is an anxiety disorder. Parents may feel a level of guilt thinking it's their fault, and that may cause them to avoid. I'm hesitant to say invite them into the school, because if they see their child not talking at school, they might be the person who puts that excessive pressure to speak on their child. So if that was to be a strategy that you used, I would just be very cautious, make sure the parent very much understands how detrimental applying excessive pressure to speak would be. So I might not go to that one first. But yeah, no, and obviously reach out to learning services. I mean, anyone on the Selective Mutism committee would be more than happy to meet with the parent. Like you said, there is that sort of that genetic history of shyness or social anxiety that parents often have. So anything that we can do to make them more comfortable, maybe they be more comfortable meeting on Zoom or on Teams where they can keep their camera off. Those are some ideas to help with not stall progress, with parent reluctance to engage.
Great questions.
Mm-hmm. Autism and ADHD, but you also think they have selective mutism. I'd be curious to talk about that maybe further. Because children with autism typically have like language delays, which is the reason for them not speaking. So I'd be curious to find out some more information about why you think they may also have selective mutism. I'm not saying it's impossible, but we want to really ensure, is the reason the child isn't speaking because of language delays associated with autism?
Hi, I'm the one my name's Kim. I put this on here.
Mm-hmm.
I teach in an ES2 setting, so this child is in an ES2 setting and does not speak at all. And I have many children who are autistic, and it's not because he cannot speak. He does speak at home, but does not speak at school. I have been told by the doctor it could be a result of medicine, but I've also never seen that side effect before. So it's kind of we're in the process of trying to figure this out.
Yeah, it would be interesting to do a conversational visit and see if the child would speak to someone he's comfortable with, like, so for example, like a parent in a school building, to help rule out whether or not the not speaking is due to language delays versus an actual fear of speaking.
Yeah, and this child is also ELL, so there's a lot going on.
That's another factor, absolutely.
Yeah.
I mean,
yeah,
there's that science
really
period.
hard. Yeah.
No, absolutely. That's a complex scenario because there's definitely lots of things to rule out.
Yeah.
What grade?
Grade 5.
So I'm assuming he has received lots of speech and language assessment.
Some, yeah. This is the first year I've had him. He was in an ES1 program before.
Okay, interesting. Yeah, definitely. That's more of a complicated situation with the ELL, the autism.
Yeah.
Whoa. But definitely, I mean, it doesn't hurt to implement these strategies. Like,
yes.
Having a conversational visit is not going to harm a child.
Okay.
So, using those visits to kind of help rule in and rule out different possibilities about whether or not it is a fear and anxiety around speaking. How verbal is he at home?
Mom says more than at school, but not a lot.
It might be, children with language delays can just feel uncomfortable speaking because they know their language skills are weak. But the fact that he's not speaking at all at school, like not even to a peer, not even to an EA.
Well, he will. But he doesn't ask questions, or he doesn't. But if you ask him to read, it's very, very reluctant.
And would that be related to his skill level at reading?
No, not the ones that not what we're asking him to read.
Okay, so say that again.
Not like, I mean, what I'm asking him to read, I know he can read.
Gotcha. Okay. That is an interesting case. I would certainly try some conversational visits with someone he's comfortable speaking with, just to kind of help tease that out.
Yeah.
That is more of a complex case for sure.
Yeah.
And depending on your I don't know what school you're at, but if your psychologist or your language therapist could be involved.
Yeah. We've started bringing it up so I will continue with that. Yeah.
Okay.
Okay, that's a good start. Thank you.
For a high school student who is diagnosed with selective mutism in a science lab setting, the student has not been able to speak to lab partners yet. Can they use nonverbal forms of communication? Like, is the individual able to write to communicate?
They can write, but they seem really unwilling to just interact at all with their lab partners. Like, they'll kind of just stand in the corner and like not even participate in the lab really at all.
So that's that social anxiety piece probably. Would there be a possibility for, like, do they have any peers that they will speak to at school? Can we purposely pair them with individuals that they feel comfortable speaking with? Is there anyone
I've never seen the student interact with a single person in the building, to be honest.
And they're in high school. That's
and it's a bit disrupted too because of with COVID. Like, all the high school kids didn't really get the chance to meet each other when they came in. And the students knew the district. So like they weren't in junior high with the other kids who came in for high school.
Oh, and do we have information from parents whether were they speaking at their previous school?
I actually don't know. All I know is that the parents are pretty reluctant to work with us in terms of helping with this.
Yeah, I would try to get the parents to understand what's occurring. I mean, is it possible? I mean, I guess we're already into January. You would think that if it was just shyness.
They're diagnosed with selective mutism. Like, they do have an LSP and everything. It's just the parents actually called and asked if they could have it removed. I don't know why they wanted it removed, but yeah, I've been teaching the kid all year because I'm his, 2 years now actually. I'm his honors biology teacher, and we're just moving into a lab intensive semester. So with lectures, he's kind of like skated through okay, but now we're going into a semester where it's all labs and all group work.
Mm-hmm.
I want to be able to help him, but at this point, I kind of just feel stuck with it.
Yeah, it would be interesting if parents were willing to share, or even if we have documentation from like previous IPPs or whatever they were called at his previous school, to know what his speaking was and whether it's regressed due to the change in school. Certainly having implementing these conversational visits would be beneficial. If parents aren't willing to be the conversational partner, we could explore whether there's a peer that maybe he feels more comfortable with, a sibling in the school.
He does have a sibling in the school. That might be, it's weird with grade level, but I wonder if I'd be able to get his sibling to, like, would that be in a lab setting though? Like, could I ask his brother to come?
I wouldn't start the conversational visit in the lab setting. That's when we're talking about location of conversational visits. Typically, the classroom has already been associated with anxiety, and typically we want to more private locations like an office with a closed door, a library, outside. Like for younger kids, I'd say on the playground. I guess high school there's not a playground.
Cafeteria.
But no, if this individual's in high school and they're still struggling, I find that quite concerning because they're obviously approaching adulthood.
Yeah.
I don't know if you could talk to your admin, would you be able to attend the working session that's coming up on, or you or someone from the school?
You know what? I can't, but I think I'm going to talk to my admin and my DLT and just see what the plan is with this student, just because I have a feeling it kind of slipped through the cracks with all of the stuff that's been happening over the past couple of years. Because I've never even been given any sort of instructions on what to do with him, and there hasn't really been much contact at all about it. And I just think he's maybe stalled or whatever, just
Yeah.
stuck. So yeah, maybe I'll just reach out to have them restart that process.
Yeah, reach out to them, check out the information like the manual, the other PD sessions, perhaps if one, like even if your DLCT could join that working session. It'd be
And I'm
interesting.
assuming just keeping the class just as non-stressful and not pressuring him to speak at all, right?
Mm-hmm.
Okay.
Yeah, no, definitely.
Yeah, I think I was just wondering about other ways to have them communicate in a lab without having to use words. I don't know if that makes sense, but if there's like strategies that I can use.
Yeah, absolutely. He's reluctant to write. Would he be able to use?
I think he will write. He just it's kind of getting him to engage. Like I'm trying to imagine what I would tell him to do that involves writing while in a lab with other students, if that makes sense.
Mm-hmm. And so, like, if you ask him, can you perform X activity? Will he refuse?
I don't think so, no.
So I wonder if you could just kind of talk to his lab partners about, okay, well, you know, Johnny has a difficult time communicating. You know, if they could ask him like yes, no questions, allow him to communicate more non-verbally, like some education just on their parts, kind of how we went through, encourage that active non-verbal communication. Those slides, kind of helping his lab partners to understand, you know, asking him an open-ended question is not, you're not likely to get a response. Try closed-ended questions. Try, you know, allowing him non-verbal modes of communication. It's been some time since I've been in a lab. So I'm trying to remember what kind of activities are required.
Just imagine yourself cooking in the kitchen trying to follow a recipe with a friend and neither of you know what you're doing. That's what it's like.
Okay. Yeah, definitely. If he'll follow like requests, like
Yeah,
so if
he will.
his friend says, can you please, you know, do this step while I do this step? And
So
then
I guess the question is it appropriate to say that to the partner? Like, hey, the person you're like, how would you have that conversation with the lab partner without I don't want to be calling out the kid who's selectively mute, but
yeah, I would just, I mean, they're probably really quite aware already that he's not speaking.
yeah.
So, you know, you can just say, some people have a harder time feeling comfortable talking at school. Here's some ideas on how you can get Johnny to participate in the lab if you're asking him questions. I would say that would be an okay conversation to have.
Okay, thank you.
Especially at the high school level, right? Because there's a different degree of understanding for a high school student rather than a student in grade 2.
Yeah, that's a good point. Okay. Thanks for
Yeah.
your help. I really appreciate it.
No problem.
Well, I suppose the session is over. Is it past lunch?
Yeah, no, this is just, yeah, if people have questions, if you don't have any questions, feel free to log off and go enjoy your lunch.
Right. Thank you for your time. We appreciate it. And we'll see you, I guess, another time.
For sure.
Thanks, everyone. Those were really great, rich questions. So I just kept the recording going. So I am going to stop the recording now. My apologies that I got kicked out before.